So good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your face in the video. A reminder after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one. Okay. Abet, okay, you have not, I'll place the link in the chat box later on. Okay. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher, free voucher for ROJoson telemedical consultation, either face-to-face or telemedical. So the voucher looks like this. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video, show your face. One, two, three. Again. One, two, three. One, two, three. Okay. I'll save it first. Okay, let's resume. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And starting October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. But to tell you, we are now on our 3rd year, nearing the end of 3rd year. So by May 15, we will be completing 3rd year of this pep talk. My pep talk today is entitled Asymptomatic Gallbladder Polyps Among Seafarers to Operate or Not. The empowerment objective is for the lay people, especially the seafarers, to have an essential understanding on the management of asymptomatic gallbladder polyps among seafarers as part of their health management. The reason why I thought of this topic is because there are a lot of seafarers who have a lot of concerns with gallbladder polyps, whether to have the operation or not. The contents of this particular pep talk will be the following. What is the gallbladder? What are the usual gallbladder disorders or diseases? What is or are gallbladder polyps? And how does gallbladder polyp differ, or how do the gallbladder polyp differ from gallbladder stones? What are asymptomatic? and symptomatic gallbladder polyps, how to manage or treat asymptomatic gallbladder polyps, why is asymptomatic gallbladder polyp or polyps important in the seafarers' health and occupation, what are the common challenges on asymptomatic gallbladder polyps being faced by prospective seafarers, and what are the services that ROJoson can offer for seafarers with asymptomatic gallbladder polyps. A disclaimer here is that my pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from the experiences of others as well as from myself. Let's start with the first topic. What is the gallbladder? The Tagalog term, as far as I know, is apdo. Apdo. Where is the gallbladder located? It's a pear-shaped organ, small one, on the right side of the abdomen. Okay. This is the midline. This is the right side where the liver is. Okay. So the gallbladder is located just beneath the liver. Nakatago lang dyan sa ilalim ng atay, no? Okay. So the liver and then the gallbladder there. So bandang kanan. The gallbladder holds a digestive fluid called bile, usually green ang kulay, bile, that comes from the liver, galing sa atay, and then is released into the small intestine to aid in the digestion, especially fats. Okay. So dito manggagaling sa liver, then bababa yung secretions, and then mag-i-store yung bile in the gallbladder, and then pag kumakain yung isang tao na mga fat, especially fatty foods, then the gallbladder will contract, and then will release the bile to go down into the small intestine para tumulong sa digestion of the foods. So another illustration here. Okay. So yung mga secretions from the liver, yung mga bile, papasok muna dito, na mag-store dito sa gallbladder. Pag kumakain isang tao, then lalabas yung bile, pababa into the small intestine through the common bile duct. Ito yung common bile duct. No? So what are the usual gallbladder disorders or diseases? The more common ones are the cholecystitis, which is the most common, and then gallbladder polyps, gallbladder stones, and gallbladder cancer. When you say cholecystitis, it's an inflammation or infection of the gallbladder. It can be acute, yung sudden, yung masakit na masakit, or chronic, yung palaging sumasakit, matagal sumasakit, on and off, etc. Kaya chronic. Na? At the usual cause is the stones, ang common cause. Pero kung minsan, wala ring stones, no? Nagkakos din ng cholecystitis. No? So itong itsura ng gallbladder, kung inflame na inflame, mapula, no? Magang-maga, no? Okay. Ganun din dito, another picture of a inflamed gallbladder. Malaking-malaki, nag-enlarge, no? Tapos, minsan may makikita tayong nana dyan sa pader, sa wall of the gallbladder. Okay. So usually masakit na masakit pag dinidiin yung tiyan sa kanan, no? So the other common gallbladder disorder is the so-called gallbladder polyps. Ang gallbladder polyp ito is parang ito, yung nakalawit lang dito. No? Ganon. So ito yung picture, nasa wall lang, nasa pader, no? Nakalawit siya. Ito, another picture, nilagay ko yung mga needle para ma-identify yung nakalawit na polyp from the wall. It can be single or multiple, no? Okay. And it can also be big or small, depende sa situation. So, sometimes there's a stalk. May tawag doon. Okay. Sometimes flat lang siya, no? So, okay. Most of the time, parang ito, medyo flat lang siya. A little stalk lang, then nakalawit lang, no? Okay. Now, stones naman, ito yung talagang bato, no, lumulutang, no, usually lumulutang sa loob ng gallbladder, no, hindi sa pader, no. Okay. So ito yung itsura ng bato, no. Okay, lumulutang siya, no. And then the last gallbladder disorder of concern to us will be the cancer. Kumisan, pero bihirang-bihira lang naman ito, no? So you can have gallbladder cancer arising from the wall of the gallbladder. Kaya kuminsan mahirap because yung gallbladder polyp galing din sa wall, kuminsan mahirap i-differentiate from the gallbladder cancer. Especially those yung starting ng gallbladder cancer. Usually nagsisimula sa maliit na parang polyp, then palaki ng palaki until such time that parang ano na, obviously cancer na siya. No? So what are gallbladder polyps? Let's now focus on gallbladder polyp. We will not discuss cholecystitis, stones, and gallbladder cancer. So ang topic ngayon, we will just focus on gallbladder polyp for today. So gallbladder polyp is an elevation or outgrowth of the gallbladder mucosa or wall. Ito yung gallbladder mucosa, pinkish yun. Ito yung pinakalabas na pader sa loob. Ito yun. No? So that protrudes, so outgrowth elevation that protrudes into the lumen. Okay? Lumen means yung what do you call that? Parang sa loob ng isang organ, parang lobo, sa loob ng globo. No? Ganon. So the exact cause of gallbladder polyp is not known, or you can say that there are multiple causes, pero yung exact na pag may nakitang polyp, kung ano yung cause, we still don't know. Some can be due to inflammatory reactions, kasi baka nag-inflame because of some reason, nag-inflame, kaya namamaga yung wall, okay, forms into a polyp, then we can call that inflammatory polyp, and we can only identify that during the operation. Now, some could be due to deposits of cholesterol deposits, no? Okay. So, kumisan, that's why kung may cholesterol deposits, usually it's due to high cholesterol level in the blood. Okay. The others, we don't know the exact cause. Medyo may elevation lang, but we don't know the exact cause. So, ito, to differentiate the gallbladder stones and polyps, yung stones, yun, talagang bato nakalutang. Lumulutang muna. Kuminsan, because of complications, didikit lang siya dun. So, because of inflammation, didikit siya sa wall. No? And, or some complications of stones is because of the flow of the bile palabas, baka sasalpak dun sa labasan ng gallbladder, sa cystic duct. No? So, pero itong polyp, yun lang nakadikit sa wall. No? So that's how we differentiate polyp and stones. No? Yung gallbladder stones, ang delikado sa gallbladder stones, as I said, pag kumakain ng isang tao, especially kung may fats, no? Tendency is for the bile, yung laman nito, bile, will flow outwards, palabas, into the common bile duct, pababa, into the small intestine. So kung may stone isang pasyente, sa gallbladder, pwedeng sumama itong stones palabas. No? Kuminsan, yung stones na yun, sasalpak dito sa so-called cystic duct, yung labasan ng gallbladder, cystic duct. Nung sumalpak siya, magbabara ito, lalaki ito, mamabaga, no? Yung gallbladder. No? Kuminsan naman, nakakalusot yung stones. Pag nakalusot naman, ang another point of magbabara dito sa common bile duct. No? So pag nagbara dito sa common bile duct, usually maninilaw na yung pasyente. No? Kasi yung bile is usually yellow-green. No? Pag barado, nag-accumulate yung mga bile, kaya naninilaw yung pasyente. Pero kung yung gallbladder stones ay nakasalpak lang dito sa gallbladder, usually hindi naninilaw. No? Kaya lang masakit. No? So kung may tinatawag na jaundice o naninilaw ang pasyente, kung dahil sa stones, no? Andito siya at nakasalpak siya dito sa baba. No? So hindi makadaan yung bile pababa into the small intestine. No? So yan ang danger ng gallbladder stones. In contrast, Yung gallbladder polyp kasi nakalutang lang siya, no? Kahit na mag-contract siya yung gallbladder, wala namang sasama, no? Wala namang magsasalpak dito sa cystic duct. Kaya yung gallbladder polyps, usually they don't cause obstruction, they don't cause jaundice, gano'n. Okay? That's the difference between the two, which we have to remember because yan ang magiging sagot doon sa bakit pwedeng hindi operahan yung gallbladder polyp, no? Yung gallbladder stones, bakit mas maganda kung operahan, no? Ganon, may indication for operations, no? So what are asymptomatic and symptomatic gallbladder polyps? The difference between the two, of course, isa may A. Yeah, asymptomatic, isa walang A. No? Asymptomatic gallbladder polyps are those without symptoms. A mean wala. No? So walang nararamdaman whatsoever. Walang abdominal pain, walang jaundice. No? Symptomatic gallbladder polyps naman, kuminsan may gallbladder polyps nagkakaroon ng symptoms, nagkakos ng cholecystitis, no? Okay, na inflammation. Kaya meron siyang symptoms, no? Okay? And usually ang symptoms na yon ay masakit ang tiyan, abdominal pain. So, asymptomatic gallbladder polyps are usually discovered incidentally or accidentally through the ultrasound of the abdomen. Kasi isang pasyente, kung may gallbladder polyps siya at asymptomatic, the only time that it will be known or discovered kung na-examine yung tiyan niya through an ultrasound. So yan ang yan ang pinaka-common reason, common method how asymptomatic gallbladders are being discovered. Usually use ultrasound during check-up, during yung mga routine na pinapa-examine sa tiyan, no? Asymptomatic gallbladder less than 1 centimeter in size. Okay, we now talk how to manage or treat asymptomatic gallbladder. Okay, so asymptomatic gallbladder polyps less than 1 centimeter in size, minsan merong magre-recommend 1.5. Pero the common recommendation is ito yung pag less than 1 centimeter is usually managed with wait and see or watchful waiting approach, meaning no operation is needed, just monitoring with ultrasound at planned intervals, no medications, improvement ang pwede lang gawin, ang improvement of lifestyle into an healthy one, like healthy diet and exercise. Okay. So to repeat, ang management of asymptomatic gallbladder polyps, ang recommendation is that those less than 1 centimeter, as I said, some would recommend 1.5 as the cutoff, no? Okay. Walang operasyon, hindi kailangan, wala kasi nararamdaman, no? And then just monitoring with ultrasound. Bakit ultrasound? Kasi yun lang paraan na makikita ng gallbladder polyps, no? Hindi naman natin makakapa, hindi naman natin nakikita, no? From outside. No medications needed because wala namang nararamdaman, di ba? And then we don't know how to, at the moment, we still don't know the cause. Kaya the most that we can do is just improve the lifestyle. It could be due to cholesterol, could be due to smoking, drinking a lot of alcohol. So kaya importante, just palitan lang yung unhealthy lifestyle into a healthy one. No? Hopefully, hoping that that polyp will disappear. No? Okay. So operation is indicated only, okay, kailangan operahan lang if the polyp is 1 centimeter in size or bigger, even if asymptomatic. Kahit na walang nararamdaman, but if the polyp is 1 centimeter or size or bigger already, then usually nire-recommend for operation. As I said, some would recommend 1.5 pa nga. No? Okay. This is because of the risk of the gallbladder cancer. Yan ang nakakatakot lang ito sa gallbladder polyp. Baka umpisa yan ng gallbladder cancer. But bihirang-bihira lang ito. Usually 1% lang yan. No? Okay. Bihirang-bihira yung gallbladder cancer among gallbladder polyps. No? So, And note here, operations is indicated if the polyps is even if it's less than 1 centimeter, but the patient is symptomatic. Sabi natin, sumasakit ang tiyan, pero maliit lang yung gallbladder polyps. No? It's because baka nagkaroon siya ng cholecystitis, inflammation. Kaya kailangan pa rin operahan. No? Pero kung walang nararamdaman, less than 1 centimeter, pwedeng hindi operahan. This is the usual recommendation. No? What are the recent guidelines in ultrasound monitoring of gallbladder polyps? Ito yung pinaka-recent na 2022, I guess, no? 2022. Oh, yeah, okay. Ito pinaka-latest na na-pick up ko from the internet, okay? So, ang recommendation, and this will support the stand that hindi kailangang operahan o operahan kagad, na? So, in low-risk category, no follow-up, even wala nang follow-up is recommended for polyps less than 6 millimeters or smaller. Okay. So 0.6 centimeter or 6 millimeters or smaller, parang walang masyadong risk, no? So pwedeng hindi rin i-follow up. That means you don't have to worry about the polyp that is less than 6 millimeters. Now, for those polyps na medyo malaki ng konti, 7 to 9 millimeter, no, you recommend to do ultrasound every 12 months. No? Every 12 months para makita kung lumalaki. Kung di man lumalaki, pwede hindi naman operahan pa. No? Now, for those polyps which measures 10 millimeters to 14 millimeters, no? So 1.0 to 1.4, mas frequent yung ultrasound follow-up kasi higher risk for possibility of cancer. So pwedeng gawin ng ultrasound in 6 months, no? Kaysa 12 months, then umpisa sa 6 months, then 12 months, kung stable pa rin, no? Hindi siya lumalaki, then 12 months, 24 months after, 24 months, then 36 months. Usually good for 3 years, monitor, no? Kung di naman siya lumalaki, observe pa rin, no? Now, kung lumaki yung polyps to 1.5 centimeter or 15 millimeters or larger, usually inooperahan na. Okay? But because malaki ang risk for gallbladder cancer. So surgical consultation is recommended for polyps 1.5. Ito mas conservative. Yung iba naman, 1 ang cut-off ang ginagamit. No? Okay. Ito pinaka most recent recommendation by the Society of Radiologists of Ultrasound in the US. So why is asymptomatic gallbladder polyp or polyps important in the seafarers' health and occupation? Nowadays, part of the routine medical examination of the seafarers includes ultrasound of the abdomen. Dati-dati wala yan eh. So nung pumasok na yung mga test na ultrasound of the abdomen sa lahat ng mga seafarers na aalis, no? Okay. So yun lumalabas yung mga gallbladder polyps, no? As I said, the gallbladder polyps can only be discovered by the ultrasound. No? At since madalas ginagawa, kung may polyp, makikita na. Okay? So, ultrasound can easily detect gallbladder polyp even if a seafarer is asymptomatic. Kahit na siya walang nararamdaman, makikita yung gallbladder polyp through the ultrasound. And the gallbladder polyp is commonly detected on ultrasound even if the seafarer is asymptomatic. So with the detection of gallbladder polyp on ultrasound of the abdomen, a decision has to be made by the manning agencies, yung mga nagbibigay ng go signal by the doctors usually, kung pwedeng ipasakay yung ipa-deploy yung seafarers going abroad, working abroad. Okay? So the decision has to be made to operate or not to operate. And most of the time, physicians of the manning agencies would recommend surgical removal even though watchful waiting can be done. As we said kanina, pwedeng watchful waiting ka, pwedeng di operahan, pero most of the time, the present practice, at least in the Philippines, as far as I know, I don't know what in other countries, kung ganun din, no? ang mga doktor dito sa mga manning agencies would usually recommend removal of the gallbladder together with the polyps. Yan ang current practice. So this is a big challenge for the seafarers with asymptomatic gallbladder polyps. Kasi marami rin nagtatanong sa akin, mga seafarers, wala naman akong nararamdaman eh. No? Bakit ako magpapa-opera? Pero yun ang recommendation ng mga doktor ng manning agencies. No? So, what are the common challenges faced by asymptomatic gallbladder polyps faced by prospective seafarers? As I said, the biggest challenge is whether to undergo operation for removal of the gallbladder polyps as required by the physicians of the manning agencies. And knowing that asymptomatic gallbladder polyps less than 1 centimeter can be treated by watchful waiting and observation. So kung alam ninyo na pwedeng hindi, pero nire-recommend ng manning agencies, ng mga doktor doon, magtataka na kayo kung saan. Kailangan ba talagang opera? Pwede bang hindi na? Okay? So, if the physicians of the manning agencies would respect a recommendation from a surgeon that there is no need for operation, then no problem. Okay? Walang problema. No? So, let's say if physicians ni-refer sa akin, for my opinion, sabihin ko, hindi kailangan operasyon at nire-respect naman niya, so hindi kailangan operahan, hindi ma-opera ng pasyente. Pero kung yung doktor dun sa manning agencies, talagang sarado ang utak niya na kailangan operahan, then talagang malaking problema dun sa seafarer, yung mga seamen. No? Okay. So options in case operations is required by the physicians in the manning agencies. These are the options that one can take. Okay, if seafarer with the asymptomatic gallbladder polyps. Number one, the seafarer can proceed with the operation so that one can be deployed as soon as possible. Kasi kung talagang insistent yung doctor, hindi kita bibigyan ng clearance, kung di ka magpa-opera, pero wala ka ng ibang choice, kailangan may trabaho, then you may be forced to go with the operation. So the second option is kung pwede, kung kaya, look for another manning agency, okay, where their physicians do not require operation as long as there is a recommendation or medical clearance by a surgeon on no need for operation. And the last option is, of course, kung di kayo makalusot dito sa dalawa, or especially the first one, you have to look for another seafarer job or non-seafarer job. Okay. Ibang trabaho na hahanapin nyo, no? Kung pwede, kung kakayanin. Okay. So what are the services that ROJoson can offer for seafarers with asymptomatic gallbladder polyps? Okay. Number one, I do this pep talk, patient empowerment talk, to enlighten the lay people, particularly the seafarers, on gallbladder polyps, especially on the options of management, which I just mentioned earlier in tatlong options. No? Then I can also, because I personally believe na yung mga guidelines ko, kung less than 1 centimeter or even 1.5, asymptomatic, walang nararamdaman, no? Pwedeng hindi operahan. So I can give a medical clearance for deployment in asymptomatic gallbladder polyps less than 1 centimeters with a caveat, but I always tell the seafarer that the final decision rests on the physician of the manning agencies. Well, I can only recommend, but the final decision will be on the physicians of the manning agencies. The third service that I can offer, I can do the operation, but I only do open cholecystectomy, which is cheaper, which has a good results, as good as the tinatawag na laparoscopic cholecystectomy, and I can do it a compassionate fee, no? Para matulungan lang yung seafarer. Then I would assist the seafarers in looking for a hospital which can offer operations at a low cost. Kung sakaling di niya kaya yung mga private setting na operations, I will try, no promise, no, to look for hospitals which can offer the operations at a low cost. yung mga government, especially the government hospitals. So these are the services that I can offer to the seafarers with asymptomatic gallbladder polyps. So I'm done with my the main talk of my topic, asymptomatic gallbladder polyps among seafarers. Okay. So I have discussed what is gallbladder, what is the usual gallbladder disorder, what are gallbladder polyps, how do they differ from stones, what are asymptomatic and symptomatic gallbladder polyps, how to manage asymptomatic gallbladder polyps, and what is the concern of the gallbladder polyps to the seafarer, and then what are the services that I can offer for the seafarers with asymptomatic gallbladder polyps. So takeaway in relation to patient empowerment for this particular pep talk, I'll be always in touch with reliable medical information on asymptomatic gallbladder polyps among seafarers. Knowledge is power. It gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions or make better decisions on the management of asymptomatic gallbladder polyps among seafarers as part of your health management. So with that, before we go to the question and answer portion, okay, reminder, please take the online learning cum evaluation test exercise for mastery of learning to have a perfect score to get a certificate like this. As promised, I'll place the link after the pep talk. And then reminder, please, obtaining 50 OLETE certificates. I would encourage you to take this for your mastery of learning, okay? And then get a certificate so that you can have a voucher for a ROJoson free medical consultation, either face-to-face or telemedical. Usually before it used to be just telemedical. Now I have extended it to even face-to-face. And then feedback, please type in your feedback in the chat box during the open forum and before we adjourn. Okay. So with this, I end my pep talk. Okay. Asymptomatic gallbladder polyps among seafarers, to operate or not to operate. Okay. I hope I empower you to have an essential understanding on the management of asymptomatic gallbladder polyps among seafarers as part of their health management. So let's now have a group picture taking before we start the QA and interactions. Okay. You ready? Show your faces. 1, 2, 1. May pahabol. 1, 2, 3. May pahabol pa yata. Second one, may humabol. 1, 2, 1, 2, 3. Oh, may pahabol pa. Last na ito. Mayan, masali ka ba, Mayan? 1, 2, 3. Okay. So the floor is now open for any questions, any comments, any recommendations, and sharing of experience, as well as consultations, short consultations. Anybody? Feel free to ask questions. Okay. How many? Okay. I see a new name here, Baluya Stephen. Are you a seafarer?
Yes, Doc.
Okay, good. Pero bakit? Oh, sige. Where did you find Where did you read my notice?
In Facebook only.
Sa Facebook. Okay. So, okay. So, yung iba hindi nag-attend. I was really targeting mga seafarers, no? Pero ikaw lang yata ang nag-attend ngayon dito, no? Okay. I do this pep talk regularly every Saturday, no? Okay. So, nag-decide na lang ako for this year, I'll devote one lecture on this topic kasi I know very common ang concern ng mga seafarers, no? So, I was hoping na marami mag-a-attend. Okay. Pero ikaw na lang nag-attend. Pero okay. Do you have any question, Stephen?
Yun sa akin, Doc, yung 0 ano yung ano sa akin, 0.7 cm ba?
0, 0
Paano
point,
po 7?
0.7 polyp.
Opo.
Ang
Yes
reading
po.
polyp.
Yes po, poly.
Ha?
Yes po,
Okay. Ang
poly.
reading polyp, walang stones. Walang
Wala
binasa.
po.
Okay. So, kung wala kang nararamdaman, strictly speaking, you don't need an operation. No?
Yes.
Okay. So, anong sabi ng doktor sa manning agencies niyo?
Sabi, obserban lang daw.
Good. Very good. Mabait pala yung doktor niyo doon.
Pero next time daw, sabi sa akin,
Ah,
pagbalik ko, operan daw ako. Kaya, kasi multiple na din po kasi siya eh.
yung multiple,
Polyp.
actually, mas nakakatakot yung isa kaysa multiple.
Okay.
Okay? I mean, based on my expertise, my personal experience, na? Kasi gallbladder, ang kinakatakutan lang natin sa gallbladder polyps is gallbladder cancer, di ba? As I said,
Yes.
na? Yung gallbladder cancer, usually isa lang yon eh. Isa lang, isang area lang, na? Pero kung multiple ang polyps mo, usually mas maliit ang risk for gallbladder cancer. Kung iisa lang yan at lumalaki every 6 months, every 1 year, every 2 years lumalaki, yon delikado yon, na? Okay.
Yes po.
So, okay. So, anong nakasakay ka na?
Ah, ano na, pangalawa.
Okay.
Tapos, nga nakatatapos lang ng medical. Yun ang sinabi sa akin na baka daw next, pagbaba, next medical, baka ma-operan daw po ako.
Hindi, basta kung magpa-ultrasound ka ulit at pareho pa rin, usually papa-ultrasound ka ulit, di ba? Pagbalik mo,
Yes,
di ba? So, papa-ultrasound ka, ay kung walang pagbabago, pwedeng hindi naman. Na? Okay. Anong manning agencies mo?
CF Sharp.
Ha?
CF Sharp.
Sure.
CF Sharp.
Okay. I-type mo nga mamaya dyan para alam ko. Kasi kamisan kinokollect ko yung mga pangalan ng mga manning agencies na nakikita ko medyo yung mga lenient yung mga doktor, no? Okay. Pero may mga ibang doktor talagang mahigpit sila, no? Okay. 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 Very good. Okay. So nasa iyo na kung gusto mo pa opera, pero sa akin kung wala kang nararamdaman, pwedeng hindi. Okay. Super care. Super care or dalawa?
Yung sa medical ko po, sa Super Care, yung manning agency ko po, CF Sharp.
Ah,
Doon po ako nag-medical sa Super Care.
okay. Yeah, okay, tama. Kasi meron akong mga ibang seafarer na from Super Care, medyo rational sila, nakakaintindi, na. Okay. So, Super Care, pwede, na. Okay. Okay. May ibang tanong ka pa ba?
Okay na po. Thank you po.
Wala na. Wala ka ng ibang
Wala
tanong.
na po. Thank you po.
Okay. So, wag lang, basta wala lang bato. Pag may bato, mahirap i-clear eh, no? Okay. Okay.
Opo. Sa awa
Pag
naman po
polyp
ng
lang,
Panginoon.
pwede, no? Okay.
Polyp lang.
Okay. Any other questions, comments? Any relatives of yours who have gallbladder problems when they try to get medical clearance? Anybody? Wala? I hope you can extend this information to other people kasi yung advocacy ko kaya ako nag-create ng isang Facebook group on Filipino seafarer health. Alam ko maraming concern yung mga seafarer on this particular topic, no? So, and I was trying to convince the doctors manning yung mga nagbibigay ng clearance kung pwede i-follow na lang yung guidelines ng international guidelines na hindi kailangan operahan, no? Okay. Pero whether they will listen, I don't know, no? Kaya yan ang isang services that I just offer to do public information na hindi kailangan, no? Okay. Pag nagpa-opera ka, Ma'am Stephen, wait, tanong ka lang, kung magpa-opera ka, sa account mo yan, di ba?
Yes po, yun ang ano nila eh.
Okay, wala namang, unless pupunta ka sa government hospital for operation, pero yung mga sa private hospitals, you have to shoulder the expense, di ba?
Yes po.
Oh,
Ayoko din po ma-operahan kasi wala naman po ako nararamdaman eh.
Okay.
Asymptomatic.
Sige, okay. So, I hope super care.
Mag-message na lang po ako sa inyo pag ano.
Okay. You're always welcome to approach me kung may problema ka, no?
Yes po.
Okay. So, any more? Mga relatives natin? Pag stones, hindi ko talagang makiklear, mahirap i-clear yung stones, no?
Yes po. Stick po sila sa ano, sa pag-stone. Automatic po, operation po agad.
Yeah.
Yung sinasuggest ng ano,
Yeah.
managing
Yeah.
agency.
Pero kung di ka seafarer, kahit na stones, kung wala nang yung tinatawag asymptomatic na walang nararamdaman, pwede ding hindi operahan actually, no? Yan ang
Yes po, katulad dun sa kapatid ko na IT. Stone naman po sa kanya eh, kaso yung agency niya, hindi naman pinapa-opera. IT kasi siya eh, tapos dito lang naman siya.
dito lang, okay. So dito hindi siya magta-travel, no? Okay.
Yes po.
Kasi ang problema kasi yung concern yata ng mga seafarer, yung pag-travel baka abutan kayo kasi hindi natin masasabi kung kailan aatakihin ng ano, no, yung sakit, no?
Yes po. Yun din po ang paliwanag sa akin. Yung surgeon. Na
Oo.
pag sumakit, syempre, wala po hospital, malayo.
Malabo tsaka
Iniiwasan ng manning agency na gumastos sila ng ganun.
Ang issue kasi ay iniiwasan nila yung gastos din, di ba? Gastos na
Yes po.
i-airlift, no? Okay?
Yes po.
Kasi mahal 'yon, di ba? Okay.
Opo.
Okay. So yan ang for those who are not familiar with the reasons, yon yung mga may quit sila because of the expenses that the company will have to spend, no, when a seafarer will need an operation, no? So i-airlift, dadalhin sa hospital o kaya doon sa ibang bansa, no, malaki ang gastos, no? Kahit may insurance naman din kayo, di ba? Di ba?
Sa amin, private lang insurance ko sa manning agency namin. Pag nakasampa ka lang, may insurance na. Pero pag nasa lupa, wala po.
Oo nga eh. So, bakit hindi nila gamitin yung yung insurance kasi hindi mo talaga mapipredict ano mangyayari sa buhay ng isang tao eh, di ba? Sa isang katawan,
Yes po.
no? kahit na hindi ka seafarer, pwedeng biglang sasakit. May kakaroon ka ng sudden illness, no?
Yes.
Anyway, yan ang challenges ninyo, no? Okay.
Yes.
So, any more questions? Comments? Lana? Anything you want to add? Abed, you want to add something? Gusta? Rochelle? Anything you want to add? May mga insight kayo rito? Perla? May mga reflection kayo rito after listening to this talk?
Doktor, ano ba yung sinasabi nila? Di ba yung ginagawa ng laparoscopic surgery? Yan ba yan? Ginagawa mo?
Oo.
Oo, yung
Laparoscopic
laparoscopic surgery.
surgery, laparoscopic cholecystectomy, tinatanggal din yung gallbladder, pero ang pagtanggal nun, sa papamagitan ng isang TV monitor, so ipapasok yung isang camera sa tiyan, usually dun sa may pusod, no? May isang butas, ipapasok yung camera doon para naka-connect sa TV monitor. And then, sa ibang area, magbubutas sila 2 o 3, doon ipapasok yung mga mahaba ng instrumento na panghila, pang-cut, pang-dissect, pang-suctions, gano'n, no? So, usually natatanggal din yung gallbladder, no? Compared to open naman, yung may hiwa doon sa tiyan, no? Sa bandang kanan. And then, pagtanggal ng gallbladder, it's under direct vision, no? Tinitingnan ng surgeon yung gallbladder, no? Yung isa naman through the TV monitor, no? Ganon. So yan tinatawag na laparoscopic cholecystectomy versus open cholecystectomy. Okay? So yan ang essentially the difference in terms of technique. Now, in terms of just to tell you for the information of everybody, yung kadalasan depende sa selection ng patient, ng doktor, no? Kung minsan, pag hindi kakayanin ng laparoscopic, bubuksan pa rin, i-open, no? Hindi nila pipilitin yon, no? Kasi baka madisgrasya, no? So, pag open naman, usually, hindi na kino-convert sa lap, di ba? Okay, kasi bukas na di ba? Okay. And then, in terms of cost, siyempre, mas mahal yung laparoscopic kasi may mga gastos sa mga instruments, no? Usually, mga at least 10,000, 15,000 higher than the lap, no? Kasi may yung mga cost ng instrumento, no? Okay. Or it could be higher, especially kung ginamit ay general anesthesia, no? Okay. Yung open cholecystectomy naman, kuminsan pwedeng spinal anesthesia lang, kuminsan, no? Depende din sa sitwasyon. Kung spinal lang, usually mas mura, no? Okay. Okay. So in terms of risk for complications, mas mataas ang risk for laparoscopic. Okay, compared to open. Yung open kasi direct vision, no? Mas accurate yung mga diskarte ng surgeons, no? Okay. In terms of hospital stay, halos pareho lang, no? 1 day, 2 days, no? Pareho lang. In terms of yung recovery, usually pareho-pareho lang, mga 1 week, 2 week, at usually 2 weeks, ganon bago pa makakaalis, no? Okay. And then, in terms of pain, a little painful dito sa open kasi may hiwa sa muscle, no? Pero ang ginagawa ko, usually hindi ko na hinihiwa ang muscle, no? Tinatabi ko lang, nire-retract ko lang para hindi masyadong masakit after the operation, no? Okay? So, yan ang kaibahan ng dalawa, no? Okay? Okay, nasagot ko yung tanong mo, Perla? Unmute yourself. Unmute. Unmute, Perla. Hindi kita naririnig. Okay.
Doktor, para sa akin,
Oo.
parang mas effective yung open surgery kasi matanggal lahat yung bato kaysa compared to yung laparoscopic ba yun? Baka hindi matanggal lahat yung bato.
Hindi. Ang tinatanggal naman talaga yon, hindi ang target nun, yung gallbladder mismo na may laman bato.
Opo.
Hindi dinudukot isa-isa. No?
Pwede rin yung kayorin, ganun.
Hindi. Ito yung gallbladder, hindi yung bato sa loob, di ba?
Opo.
Yung buong gallbladder ang tatanggalin.
Mm.
Yung balot. Ah, kaya halos pareho lang, matatanggal yung bato. No? Okay. Unless yung bato nakasalpak dun sa cystic duct, mahirap talagang tanggalin, kaya ino-open. No? Okay. Pero kung yung number of stones pagtanggal, halos pareho lang. Basta matanggal lang yung buong gallbladder, no? Yung buong buo, yung balot, no? Okay. Kasi nasa loob yung stones no? So tatanggalin lang, no? Ganon, no? Okay. Ang isang delikado lang diyan, minsan mahirap makita yung tinatawag na junction between yung cystic duct, yung lusutan ng gallbladder to the common bile duct. Minsan accidentally na-injure yung common bile duct. Yung common bile duct yung pinaka-main daanan ng bile, no? So pag na-injure yun, magkakaroon ng malaking komplikasyon yon, no? Ganon, no? Okay. So yeah, mas safer pa rin yung talaga. Strictly speaking, mas safer pa rin yung open, yung kitang-kita, tinitingnan talaga, no?
Opo.
Okay.
Okay. Thank you, Doc.
Okay. Any more comments? Wala na? Oh, Maria, okay. Yeah. Thank you for joining.
Ano po, ano ho nga, is that the greatest risk ho for a laparoscopy? Yung ma-injure ang
Yung cystic
any
duct?
other?
Yung
Oo.
cystic duct? Okay.
Oo. Yun ho ang pinaka nakakatakot.
Good. Okay. Alright. Good. Matagal ka na din nagagamit ng whiteboard. Okay. Ito yung gallbladder. Nakikita mo yung drawing ko?
Opo. Yes.
Ito pupunta sa intestine, no? Ito andito yung atay, liver. Okay. So, dito bababa yung bile, pababa. Ito yung tinatawag na common bile duct, no? Common, it's a bile duct. Kasi ito dalawa, may right and left hepatic duct. So, mag-confluent siya, didikit siya, pagbaba, ang tawag ng common. Parang isa na lang, common bile duct, no? So, ito yung mga, sabihin natin, ito yung bato, no? Okay. So, ang ginagawa ng, saan yung color nito? Ang color. Okay. So, pag tinatanggal yung gallbladder, dito kinakat, na? Okay. So, ito yung buong gallbladder tinatanggal, na? So, perla, ayan sinasabi ko, yung lahat tatanggalin. Hindi susungkutin ng mga bato sa loob. Basta tanggal na lang lahat. Kaya dapat walang naiiwan, na? Okay. Now,
Doctor.
going to that question, yung ito kasi pag ligate nito, pag hindi nakita maigi ng yung gumagawa ng laparoscopic, kumisan nahihila ito, no? ang nalaligate o tawag doon, ligate is na natatali, no? Ito, yan, no? Okay. Compared to pag open, usually hinahanap yan. Hinahanap din ng sa lab, pero kung minsan mahirap hanapin, no? Okay. So, mas mataas ang incidence ng accidental ligation nito. Pag nag-ligate ka rito, grabe ang komplikasyon nito kasi maliit lang ito at daanan ng mga bile ito, di ba? Okay.
Naku.
Yon. So, yan ang pinaka-dreaded complication ng laparoscopy kung na-ligate ito, no? Accidentally, no? Na hindi na kumisan kasi kung talagang mahirap na operasyon, iba-iba yung anatomy ng mga tao, no? Kaya kuminsan, kadalasan yung mga laparoscopic, naglalagay silang allowance, nilalayo nila, no? Dito sila nagka-cut, no? Para to make sure hindi matamaan itong common bile duct, no? So pag dito tinali naman, may small complications kasi baka may natitirang parang portion ng gallbladder, di ba? Ito. So baka magkaroon din ng bato dyan o ano, no? Ganon. Pero bihirang-bihira lang. So to play safe, kadalasan nilalayo nila, no? Whereas in the open, usually sinasagad hanggang dyan pwede. Kasi kadalasan nakikita nila yung common bile duct, no? Okay. Did I answer your questions? Malinaw?
Yeah, opo. One more. Although it's not about the gallbladder. Is the laparoscopy ginagawa rin ho for hernia?
Oo. When you say laparoscopy, oscopy means, ang tawag oscopy? Parang tinitingnan, parang endoscopy, laparoscopy, no? Yung through the scope, no?
Oo.
So ipapasok ito yung tiyan, ito yung cavity, di ba? So, ito yung hernia, no? Ganon. Ito. So, ipapasok nila yung instrumento sa loob, no? Lap means through the abdomen, no? So, under TB monitor, no? So, i-ano nila, ilaligate nito, no? Itatali ito para hindi makalusot yung intestine pababa, no? Ganon, no? Okay. So, laparoscopic herniorrhaphy tawag doon. Whereas dun sa gallbladder, laparoscopic cholecystectomy naman. Okay. So, ibang term. Pero basically, it's the use of laparoscopic, no? Meaning, papasok sa tiyan, no? And then using yung mga instrumento na may camera at yung mga malalaking instrumento, no? Okay. Laparoscopic cholecystectomy, laparoscopic colectomy. Okay? So depende na kung anong gagawin. But basically through that approach, no? Compared to, in contrast, when you say open, bubuksan yung tiyan, no? Bubuksan yung tiyan, no? Para gawin. O dito open sa laparoscopic, hihiwain dito. No? Okay. And then under direct vision, hahanapin nila yung hernial sac, yung gustlos, then itatali nila, no? Okay?
So basically the danger is probably the same kung yung laparoscopy sa hernia, they might have cut at the wrong place. Pwede rin ho mangyari yun, ano?
Pwede,
And then,
pwede. Pwede mangyari yun, no? Kaya importante may training sa laparoscopic, no? At usually
I asked her because I had again a good friend just last year who died because of a laparoscopy sa hernia.
talaga?
Opo, na ano siya, kasi ho natamaan something eh.
Hala?
Meron hong natamaan.
The big
So she
vessels,
was-
malaking vessels na tamaan.
Oo, hernia ho eh.
Kaya nga,
So,
blood vessels ang kalaban mo dyan.
oo. So ang nangyari, nag-sepsis na. She was discharged, but she was complaining of pain, and the doctors were saying a part of it, but after a day, hindi na ho nakayanan, and she was brought back to the hospital. They opened her, and they found out that that was what happened. So in 24 hours, so after her second admittance, she was dead. She died. And
Ano kaya ang cause? Ano kaya
yun
ang
nga ho, hindi ho mabait ho yung kanyang family. They did not pursue anything more, but we were all thinking it should not have been, because it was just as again, you cannot, you're kind of bound by
Oh, sige.
ayun.
Can I ask my son to comment on that?
Yes,
Lance?
please.
Kung
Ano kaya
sepsis,
nangyari doon?
baka may natamaan na bowel or baka incarcerated na bowel na baka na perforate. Kung sepsis tapos
Maybe yun ang-
nag-spillage. Yun lang
Oo.
maisip ko na possible na sobrang septic na
Sepsis
ikakamatay ng na ganun ka sudden. Baka may bowel na may involvement ng bowel na baka may spillage or baka incarcerated na nag-necrose tapos yun.
Yeah,
Mabilis. Bilis talaga. It was very, very fast.
okay. So hindi siya
Pag
bleeding.
hernia kasi pwedeng bawal yung bawal yung nag-hernia tapos siguro sa manipulation or sa ischemia baka pwedeng may area na pwede na nag-perforate tapos may spillage na ng bowel contents na nag-cause ng sepsis. Pero we can only assume or guess kasi hindi natin alam yung totoong yung events talaga.
Yun na
Pero
lang
kung fulminant sepsis na ganun kabilis yung course, baka ganun usually yung nakikita sa mga yung may spillage ng bowel content sa abdomen na mag-cause ng severe sepsis.
Oo.
Okay?
Yes.
Okay.
It's very sad. Okay. Thank you ho.
Yeah.
Kaya I think probably when you're faced with it, open surgery na lang talaga para nakikita.
Mas yung open surgery.
Masakit lang.
As a rule, mas safer talaga yung open.
Oo, doktor.
No?
Yung
Pero,
doktor, may tatanong ako, yun bang mga surgeon, lahat ba ng surgeon marunong din sa ako, may training din sa yung ganun, laparoscopy? Surgeon ba
lahat.
din ba yun?
Hindi lahat. Yung anak ko may training, ako wala. Old
Oo,
school
kasi
ako.
siyempre kung wala ka namang training, hindi ko naman di ba?
Hindi ko gagawin yon.
Opo.
Kung wala akong training, open ang gagawin.
This doctor was, according to the family, was very, very, was really good at that. But I guess at that moment, that precise moment,
hindi ka naman makapag-file kasi sabi, ganyan talaga. Siyempre, di ba, doktor?
ang hirap. They opted for
pero meron noon, di ba, doktor, yung kay Dr. Agbayani ba yun?
Oo.
Nabasa ko sa newspaper. May nag-file yung lawyer na inoperahan niya. Na siya di ba, nabilang ko siya
Convicted,
he was convicted. Then after a month, namatay siya. Oo, parang si Dr. Agbayani pangalan nun.
Agbayani,
Sa Maddox ba yung doktor?
Kilala ko.
Oo, siya nga minsan nga nagkaano ako doon sa baba, doon sa rehab. Sa rehab siya
Orto siya, orto.
Opo, orto. He was convicted because siyempre lawyer yung nakaano niya.
Okay. Anyway, basta tandaan natin, palaging may options for the different types of surgery, and then
Yes.
doctor will be in the best position basta wala siyang bias towards one option. He has to look at it very objectively. Kakayanin ba nito ng, so pag-usapan natin open versus lab. Kakayanin ba ng open? Kakayanin ba ng lab? Kung di kakayanin ng lab, sasabihin niya, hindi kaya, no? Huwag nating gawin, delikado, not safe. I would say you should suggest na open, di ba? Ganon, no? So, huwag, usually yung mga doctor hindi, basta hindi siya close-minded, i-analyze niya muna, no? Okay? Kung anong the best option, the better option between lab or open, no? Ganon, no? And then, kung di naman the other, kasi kuminsan, kadalasan, pwede naman magawa ng lab, no? Wala namang problema, bihira lang may komplikasyon, no? Okay. So, but of course, in general, open still the best kasi kitang-kita, no? At mas mura, no? Okay.
Opo.
Other thing that you have to know is that yung titingnan mo yung track record din ng surgeon kung magaling siya sa lab, no? Kasi lab is not an easy procedure, no? Okay. It requires more training compared after the open, no? Okay. So parang kung hindi masyadong maganda yung training pa, hindi pa siya masyadong expert sa lab, wag kayo papayag doon. Maghanap kayo ng no? Mas magaling, no? Okay. Okay. So, parang ako, palagi ko inaamin sa mga pasyente ko, I don't do lab. Open lang ako, no? Okay? If they want open lab core, i-refer ko, okay? Sa ibang doktor, no? Ngayon, kung so tapos na yung anak ko, marunong siya mag-lab, sa kanya ko nang i-refer. Okay? Siya nang gagawin. Okay. So, and then the other thing is lahat ng operasyon may possible risk complications, no? Okay. No doctors can guarantee na wala. Kahit na yung Maria Justa, yung sinabi mo magaling na siya, pwedeng mangyari pa rin sa kanya yun, no? Okay. Just like sa akin, pwede mangyari din yun, no? Okay. May mga komplikasyon, no? Okay. So, what's more important is how to avoid it, no? So, minsan hindi mo ma-avoid, but at least you tried your best, no? Okay. So based on the story that you told us, I agree with my son kasi hindi naman bleeding ang kalaban, no? So baka sepsis, no? Baka yung bawal ang baka natamaan, nasugatan, no? Ganon. Okay. O kaya baka at the stage na baka yung bawal na nakadikit doon sa may butas at baka medyo compromised na yung blood supply, no? So habang nung tinatanggal, incarcerated ng tawag doon, nung tinatanggal, baka nabutas siya o pumutok, no? Ganon, no? Okay?
Yes. Thank you, Doc. Thank
You're
you.
welcome.
Thank you, Doctor. Thank you for the
Okay.
information.
Okay. So if there are no more questions, okay, we will call it a day. Meron pa pahabol? Kung meron, pwede pa. Okay, kung wala na, we'll call it a day. We'll see each other next week. Thank you. I would like to say thank you to Stephen Baluya. Ikaw lang nag-uphold ng flag ng Seafarer, nag-attend. Kadaming members sa Seafarer group, ikaw lang nag-attend. Okay. So you can also tell your Seafarer friends, no? Okay. Kung gusto nila another session, pwede rin. No, I can talk about it again, no? In other times, no? Okay. Okay. Thank you, Perla. Thank you, Maria, for sharing some of your insights and the mga experiences, no? And of course, I'd like to thank my son, Jan, who is now supporting me with all those mga consultation, the mga opinions, no? Okay. So with that, we'll call it a day. We'll see each other next week, no? Okay. So ang topic ay will be probably, kasi we might be launching the Breast Self-Exam Award na. Okay, kasi malapit na. Okay. Baka yan ang magiging topic. So, si Shirley sasali na dyan, di ba? Shirley, sasali ka doon sa Breast Self-Exam Award, no?
Opo.
Mayan, are we going to join again?
Yes po, Doc.
Okay. Si Phoebe, sasali ka ba ulit? Phoebe, o mahirapan ka mag-recruit? Okay. Anyway, we will announce it. We will try to attract more. Well, okay. Before I forget to tell you yung breast self-exam award, I'm happy that kasi last year sinabi ko pag nagpa-practice na ng breast self-exam award kasama doon at may na-discover na may breast cancer accidentally, bibigyan ko ng 5,000, di ba? To shoulder the expenses. So tamang-tama, merong isa, no? May isang sumali sa breast self-exam award, no? Hindi ko lang i-mention yung pangalan, no? And then yung kapatid niya kasali sa dun sa grupo niya, and then nakapa niya, no? After few less than 1 year of kinakapa niya, na-discover niya na may breast cancer din siya. So the breast cancer was caught in the early stage, no? Kaya sabi ko sa kanya, kahit na di siya sa akin magpapa-opera, bibigyan ko pa rin siya ng 5,000 basta magpa-opera siya, no? So at least lumabas na yung isang outcome, good outcome ng breast self-exam award, no? Kahit na isa lang matulungan nating pasyente doon na na-operahan, na-discover ng maaga at na-operahan ng maaga, okay na sa akin. Di ba? Okay? Okay. So with that, we'll
Okay, Doctor.
call it a day. No? We'll see each other next week. Bye-bye.
Thank you,
Bye-bye.
Doctor. Thank you.
Salamat po.
Bye-bye.
Happy weekend. Bye-bye.
Happy weekend.
Thank you po, Doc. Thank you po.
Bye-bye.
Bye po.
Bye-bye.
Thank you po. Bye po.
Bye-bye.